Who are you and how do you use clean language in your work?
So my name is Siobhan and I'm an advanced nurse practitioner in specialist palliative care. So I work in a hospice and I also see people at home. Um, and I heard about clean language through the Southwest Regional Group, and I love communication. I love it. And so every year I try and do something, a course or something, and we were offered the chance to do some clean language. So I jumped at it and I thought, to be honest, Judy, that it would be an enjoyable few sessions where I would get to enjoy something I love and continue to learn, polish skills that you have, learn new ones. But I didn't quite anticipate what clean language was, I don't think. I kind of understood the very basics. Um, that it was a technique that would allow us to explore, avoid a biased or assumptions, which I'd like to think I did in practice anyway. But it honestly, it just threw me because I didn't anticipate feeling clumsy with it. And that's not meant arrogantly. It's just that I like talking and I've done it for many years. So I didn't think I would spend time on a course and then feel uncomfortable to use it with a patient, but it was just so different that it took me a little bit to get used to.
And when you did get used to it, then what happened?
Well, it's not that I haven't seen this look before, but to start with, I just practiced on my colleagues with consent, or sometimes I just used it in a conversation that maybe is a conversation I've had many times. There was this member of staff and I was just passing in the corridor and she said, I said, oh, how are you? She said, how are you? And she said, busy. And I said, oh, what kind of busy? And I was maybe just, the course was on my mind. And it was like, I mean, she just turned around and then we just had this whole conversation. And later on that day, she actually messaged me to say thank you for earlier, which is lovely. But in all honesty, I have spoken to that lady a million times and we've had that conversation a million times and she's never messaged me to say thank you. And I know that sounds simplistic, but I think just when we did the course, you talked about the fact that we could ask what kind of, or is there anything else about? You said we could ask it up to 6 times in a row. And I remember that absolutely rocking my head because if I'm utterly honest, I felt like if I sat in a house and asked a patient the same question 6 times, that they might think I'm not listening. And I don't mean that rudely, but I honestly thought that. I just thought that was quite an incredibly brave thing to say and do. But then when I thought about it, if I say to a patient, what kind of pain, I will ask that question more than 6 times, very confidently. And there's no way that that patient doesn't feel heard. And the reason I know that is because they give me a different answer and a more in-depth answer every time. But have I ever had the confidence to use that in a non-clinical symptom? And that's what I did to my colleague. And it was like we had a conversation that we've had 1,000 times in a completely different way. It was like she thought about the question rather than just answered the question. It lost that kind of normal pattern route that you take. Sorry, that's not very technically explained. But also, it was almost like she worked out the answer for herself and came to a conclusion herself. And the thing that I found quite fascinating, especially as I felt a bit clumsy using this technique, and I probably still do, to be honest, but I'm definitely enjoying it. It was this look of dawning. It was this look of dawning that she had, like she worked something out.
Mm.
Um,
Is there anything else about that look of dawning?
I think that look of dawning. Um, I think it threw me a little bit, but I also quite enjoyed it, Judy. And I think that look of dawning, if I'm honest, was what gave me the confidence to take it in the house with the patients.
Mm-hmm.
And I think I've never done a course before. I've practiced on my colleagues to such an extent. It just threw me how different it was. I did see that in the house. I made myself use clean language on non-clinical subjects. That was a test I set myself because I'm happy talking clinical.
Mm-hmm.
I'm not happy talking the other things, but it just comes too naturally. Like, what kind of pain? Can you tell me anything more about the pain? We do actually use that kind of language. I perhaps didn't realize how clean it was, but I do use that anyway. So I did it on, I chose to use it on the word support. So I set myself a word rather than, so that I was really focused rather than, because what I felt, because I was a bit clumsy with it, I felt like I was squeezing it in or trying to think too much. So I just thought every time I hear the word support, I'm going to click into clean. That's what I did, if that's okay.
And then what happened? So what kind of support?
Exactly. And the answers were varied. And I did set myself a little challenge in my head. So I asked about support with regards to packages of care, because people use that word a lot. And they say they want support, but quite often, Judy, they decline the care. So why do they say they want it, but then decline it? Well, obviously, there's a million reasons, but I thought, do I know all of them? So that's why I used clean when they said they wanted more support. What kind of support? So practical support. And then I had another referral that was just for support. And it wasn't somebody that needed physical support. So I started that consultation, that first patient visit, brand new consultation in clean language, just the Jedi questions that you'd given us. I started my very first meeting with that lady like that. And that was fascinating.
And what kind of support is support that's not physical support?
So it's that lady was talking about wanting someone to talk to, and someone who wanted when I said, I kept repeating, like you taught us, what it came down to is she wanted to talk to somebody who wasn't going to use platitudes. That was her sentence, her final sentence, which is the key that I felt that I perhaps might have missed before, that how I spoke to her. She gave me a very good clue by me going clean to start with on how she wanted to be spoken to. She didn't want to be spoken to with platitudes, which in end-of-life palliative care, you could suggest there maybe are a few. So that was a really clear. And then another referral I got was for the completion of an ACP, an advanced care plan, which is one of my favorite things to do because it requires an awful lot of communication. And I went clean on that as well to start with. Felt very brave. I think I also just thoroughly enjoy it because it just gives you more than I ever thought. And what that lady came down is she wanted an ACP so that she had a voice, so she could be heard. She wanted, and it was very specific about certain things, but she felt that when she went into situations and she explained things to people, they didn't listen to her. So she wanted support that enabled her to be heard.
So support that enabled her to be heard in a situation where the advanced care plan is relevant. Now, people watching this video may not know what an advanced care plan is. The meaning I'm making is that this is a plan for the end of really the end of one's life.
So advanced care plans, yes, it does cover how you would, like, your preferred place of care, your preferred place of death, but it also is not, it's not strictly about that end stage. It's really what matters to me. It all comes out of what matters to me: patient-centered care, personalized care. So to give any kind of patient-centered care or personalized care, you have to be able to communicate with that person, don't you? So that's why I chose the ACP. So this lady actually wasn't dying, and she's actually got a prognosis of many years, but she's got a very complicated condition and she wasn't feeling that people heard her. So she wanted support with being heard. But I genuinely think, Judy, that by using the clean language approach, that You see, I think sometimes when I do this, when you do an ACP, for example, people will say, yes, but that takes a lot of time. Well, I think, invested communication does take time, but it also gives quality care, and quality of care gives efficient care. So there's always an argument against that, isn't there? But the thing that fascinated me once I became less clunky myself is I do genuinely feel, having done many ACPs and had many referrals saying support, what does that mean? I feel like I got to the crux of it quicker, not in a rushed way, but in a more articulate way, and in a way that I hope made it feel like I was listening better and not assuming anything.
So for a patient who is saying, I want support, I want to have someone to talk to who isn't going to respond with platitudes, or someone wanting to create an advanced care plan and they want to be heard in their complicated situation, those are two of the really specific areas where clean language is making a difference in your work.
Yeah, and I think, Judy, when people say, definitely, I would say definitely to that, and maybe I didn't explain it well, but when people ask for support, you could assume they know what they mean. And I would say, and I mean this maybe because of the complexity of the fact that I'm a palliative care nurse. Nobody wants to meet you, but often people feel that they need to meet you. But they don't always know what support means themselves. It helps them drill it down. It helps them find the words or to pinpoint the meaning themselves. Because I think when people say, I want to talk about the future, when people say, I want support, I think they don't always know what we can do or also what they mean. So I think with really quite difficult conversations.
And getting to the crux of it quickly is going to make a difference, is my assumption. Because if you maybe you offer care and then it's refused, or worse still, if care is offered and accepted, but that wasn't the support that they wanted. Care is expensive.
It is, but also it is expensive. And if you provide care that isn't the care that addresses the issue, it's even more expensive, isn't it? And I think that by getting to the issue quicker, you can be more efficient. But also, I felt like my consultations were of quality. I felt like, because on the first visit, especially using clean language in those first 2 visits with those really broad referrals, I need to build a therapeutic relationship with that patient to achieve anything or to give patient-centered care. And I think that to help them articulate what they meant or to demonstrate that I wanted to know so cleanly, excuse the pun, actually gave me such a strong foundation to move forward. It really felt like a quality foundation consultation that I did other consultations afterwards that I think were of a better quality. I know that sounds a little bit evangelical, but I honestly didn't realize how much this would challenge me, but also how much I'd enjoy it, because it really does help. It's quite incredible how simple. I mean, I do find the metaphors hard, Judy. I still find the metaphors hard. My challenge on that is if anyone says, like, if they even start to say like, I like, it feels like, it's like any word I do try and like reflect back and determine that I understand what they mean and all that, but I literally think I've become allergic to metaphors. I'm really hard.
I'm going to switch mode and switch into teacher mode, because one of the things that's really interesting about what you've said so far is that you're talking about a really big metaphor: support. The word support is being used in a metaphorical way.
Oh, yeah.
It's highly unlikely that what the patient actually wants is for you to get some bits of wood and prop them up.
Yeah.
They mean something metaphorical by that word.
Yeah. Yeah. Well, maybe I'm not so scared of metaphors. I think with the teaching, I thought I knew what a metaphor was, and I think we don't realize how much we use them. I hadn't thought of it like that, because actually they were using that word to explain something, weren't they? Rather than to state something in that sort of in a reality way, isn't it? Like propping up or leaning on. Yeah. You're going to send me homework metaphors. You are, aren't you?
Your homework is to spot the 6 metaphors a minute in every sentence.
I know.
And every time I do that, I start spotting the metaphors in what I've just said. So to spot is also a metaphor in that sentence. And the way I'm imagining it is like a lady with a bingo pen putting a spot.
Yeah. I think I need to practice my metaphors in meetings and away from the patients, because I can feel myself thinking too hard, that I'm not juggling the whole conversation.
And what I'm hearing is that by asking about support, which is I know a metaphorical word, but you didn't need to know that it was a metaphorical word in order to decide to ask about it, because you knew that it's used to mean all sorts of different things.
Yeah, that's true. Yeah.
And support might mean I want to talk to somebody who doesn't respond with platitudes. But what are a couple of examples of the other things that support might mean?
Well, the practical, what the gentleman meant on the practical support was, when I repeated myself multiple times and dug down, he wanted practical support that understood about what his condition was, MND, and he was apprehensive about having people that had never looked after that condition. So we fixed that I did a teaching session for his new care provider. So I guess I got to what blocked him from saying yes to the care and what his apprehension was with regard to support better. I think.
So he actually wanted people to come in and do things for him in the house, but he was apprehensive because he didn't think they understood the condition.
Yeah.
And by asking questions about what kind of support, you were able to find out what he actually wanted.
And I never thought, I'd like to think, Judy, that I'm not a bad communicator and that I don't think I know what my patient's thinking. I'd like to think that. But I think using clean language, I think it's almost like it checks that you're not making an assumption. It checks that you're not bringing something to that conversation. And I don't think I did in a harmful way, but I think you do. I think you do. You know, because care and having carers in your house, there's a million different reasons why people find that hard. But it got me this reason, you know, better.
And of course, you're bringing assumptions to every conversation you have, and you're very experienced at what you do, and you've been an excellent communicator for many, many years and done lots of courses and all that kind of thing. I'd like to ask you about a metaphor you used a couple of times at the beginning of this conversation.
Okay.
You said, "It threw me."
Okay, yeah, I did. Yeah.
What kind of threw you?
I didn't anticipate feeling so clumsy with it. I love communication. I think as nurses you become synonymous with certain things. But for me, anything that requires a hard conversation, I want to be part of that. I love the talking. So I really didn't expect it to be, I don't want to say as hard, because it's not hard in a negative way. I just didn't think it would challenge my practice in the way that it did. It really is not using, like the pain, what kind of pain. I would actively seek never to give a person an adjective or any hint in what I'm looking for when I'm assessing pain. I keep that really clean. I didn't realize how clean I was keeping it. Sometimes you meet patients that have no language for pain. So you have to find a language together or teach them one. But I will only do that when I've literally exhausted any possible clue that they give me on how they describe their pain. I think that I've applied that to the clinical, physical, and even though I would say, in the great words of Dr. Saunders, you know, symptom management is total symptom control, isn't it? It's the emotional, the psychological. I haven't used that depth of drilling down, I don't think, as well on the non-clinical. And I think that when you go to courses and you do communication courses, most of us are communication geeks and we love it, or you found things hard and you want to do them better, but you expect, well, I expected just to enjoy it and to add more to what I believed in already. I didn't expect it to just challenge my practice in a good way and make me think about it and turn it on its head quite to the level that it did. I've still got the Jedi questions and everything written on my whiteboard in the office next to me. And the other day, some of my colleagues have taken photographs of them to have them on their phone to see if they could use them. And I think I've become a bit evangelical because it's just very clever. It's really clever. And it gives a really quality conversation. But I just Judy, I just didn't expect it to be so challenging in a positive way. And I didn't expect to feel so clumsy with it to start with.
So given that it did throw you and you did feel clumsy to start with, would you recommend it to other people?
Oh yeah, I would. I really would, because you know, you can't, communication is the key to everything we do in healthcare. It doesn't matter what your specialty is, it doesn't matter what department you work in, it doesn't matter what your role is. You know, how you speak to people, you know, and you know, in the healthcare, you know, there is misunderstanding, unintentional misunderstanding, you know, in all levels with communication. And I honestly believe this has improved patient care, but I also think it's improved my conversations with my colleagues. I made a colleague feel heard. I made a colleague feel valued. I actively think that we should use our communication better with each other. I do sound evangelical, but I honestly can't say. I really believe that it would be invaluable to teach this. I think sometimes we teach about a lot of the models. I don't mean it disrespectfully, but I feel like they teach us what to say, but this teaches you how to listen, even though it gives you a script, you know, your Jedi questions. I felt like I listened better and I assumed less. And I think that that's a good way to start any conversation, really, with a patient, to be honest. I loved it. I loved it. And I still use it and I still have my notes. And I still come out of visits with a bit of a wry smile if I've managed to do a bit of a clean section. I think it's brilliant.